This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. Next up on NEA Report, COVID-19 may have impacted our way of life across Northeast Arkansas, but there's some innovation that's rising up to meet the challenge too. And a local partnership is not only offering drive-through and walk-up testing at multiple sites across NEA, but they're actually going to businesses and doing on-site testing of their employees to try to help businesses find out just exactly what they're dealing with. We're talking to the doctor that's overseeing this big effort coming up next on NEA Report.
Now, Stan Morris reporting.
Here are the latest numbers for today. As of our broadcast right now, 4,164 cumulative cases in Arkansas with 3,220 recoveries and 95 deaths. That means the active number, which you can see in the literal calculator on the left, is at 849. Cumulative cases in the United States, 1.36 million with 82,000 deaths. The latest numbers in Craighead County show 103 positive, 77 recoveries. Crittenden County, 212 positive, 178 recoveries. St. Francis at 305 with 87 recoveries. Lawrence County at 71 positive, 41 recoveries. Randolph at 22 positive, most have recovered. Greene County, 24 positive, again, most have recovered. Sharp County is seeing numbers increase this week with 25 positive cases and only 6 recoveries thus far. Across Northeast Arkansas, we've seen COVID-19 impact our way of life, but it doesn't mean adaptations aren't being made. In fact, we're seeing a lot of changes in NEA and some innovation, too, that's happening. Tomorrow in West Memphis, there's going to be a drive-through and walk-up testing site that's going to happen at 111 Dover. We're talking about West Memphis and Crittenden County, where there's been quite a few positive cases of COVID-19 so far. You're going to be able to show up and get tested tomorrow, drive-through, walk-up, whatever it is. No physician referral is needed. And it's one of several things that's actually being done by a partnership in Northeast Arkansas between Reliant Healthcare and Diffenay Family Practice. Tomorrow's event is going to be one that Dr. Diffenay is going to be overseeing, and he's joining us right now live, and we're appreciating him for being patient with us as we're working through fun technical glitches tonight and all sorts of stuff. But hey, it's good to see you, and thanks for joining me tonight.
How you doing, Stan? Good to be with you.
Thank you, sir. Appreciate you. So let's talk a little bit about tomorrow's testing event first. There's some other stuff I want to ask you about, and frankly, some stuff that I think is extremely interesting that you are doing when you're going out to businesses, and we'll get to that in a second. But first, tomorrow's event, West Memphis, what can we expect, and who do you want to see show up to get a test tomorrow?
We'll be set up in the parking lot at our clinic there at 111 Dover, and we'll have the staff on site that will be evaluating anybody that drives up or walks up and wants to be evaluated. They'll be screened briefly via telemedicine by a provider. And we're looking for people who have coronavirus symptoms, headache, fever, cough, shortness of breath, any recent exposure to someone who tested positive, anybody that thinks they might be at risk for recent infection. We will evaluate them and decide if in fact they are at risk, and we'll be offering, I believe, both nasal swab testing and blood antibody testing for those patients.
So you'll be able to find out if you have it actively or if you may have previously had it. Either of those choices. That's got to be pretty important when you're wanting to know this stuff.
Yeah, I mean, it's a lot of people have thought they had a mild case, and a lot of people don't have symptoms when they are infected. And so there's a lot of unknown information among the population that have already had it, don't need to be worried about it. We've even tested some of our own staff under the same circumstances. But definitively, we can find out if they have, in fact, been exposed with antibodies. Typically, that confers immunity to being infected with the skin. So that's why the antibody presence is important.
I'm showing folks the Crittenden County map right now because 212 positive cases there well, that's one of the largest numbers in Northeast Arkansas. There's a few other counties I think that may have surpassed that, but that's one of the areas here at least that we've seen more cases. So that's got to be, I guess, somewhat related to y'all's decision to hold that over there tomorrow, right?
Yes, it's a highly active county, especially being close to highly popular areas such as Memphis. The casinos there before the social exclusions were enforced. And recently, Governor Hutchinson also had discussed uh, his desire to see more testing being done in that area. And since we have the mobile capacity to do that, we're trying to answer that challenge.
You're doing a lot more than just this event, though, in West Memphis tomorrow. I've been learning a lot about some of the things that's been happening between your family practice and Reliant Healthcare over the past several days, and I guess maybe even weeks too. Some on-site testing stuff that's happening, and I don't know that I'm hearing about this happening from anybody else in the area except for you guys. So correct me if I'm wrong there. But tell me a little bit about your effort to go to businesses themselves and test on site, on location, and why are businesses wanting to do that?
Yeah, so recently we've had some interest with corporations who are concerned about their workforce and the entrance of the infection in their workforce. Corporation is having to shut down amid large active infections in their workforce. So companies are interested in knowing, what the status of their current workforce is. Is there an active infection group in their workforce? Certain people had the infection, and I mean, this gives them valuable information if they have active cases and are unaware of it. Since 90% of the patients are asymptomatic, we can get on that information and allow them to quarantine and isolate active infections before it penetrates the entire workforce and forces them to shut down or greatly alter their ability to perform their work.
So that's basically very important. In other words, they can find out before it impacts them to the level that it might be a shutdown situation. They can get ahead of it. Are you seeing businesses that are contacting you in large numbers? And I think one of the words I got yesterday was there was over 100 and maybe 113 tested at an event that was held yesterday or the day before this week in Pocahontas, one of the days this week. So obviously, it's there's a lot of people interested in this. What are you hearing from them?
Yeah, we've reached out to local factories and businesses such as banks, and they've been very interested in doing this. It's a quick and easy way for them to get a snapshot of where they stand, and there's been more and more interest in doing that. We have the capacity to do the testing. It's we're not doing it based on symptoms. We're doing it basically on contract with the companies to do on-demand specific testing. As long as we have plenty of testing supplies, we feel it's perfectly legitimate to offer them the service. They would rather deal with a small number of infected workers rather than waiting and finding out that half their workforce is infected. So it's really good for the community and the employers as well to keep their businesses operating and keep their workers healthy.
Well, there's been a recent push from the Arkansas governor to increase testing. There was the 2-day surge campaign a couple of weeks ago, but maybe last week. But there's also been the effort across the nation to increase access to testing. They say they want more Americans to get tested. So that's a good thing, right? I mean, we want more people to be tested for this. You're following the directions of our government leaders by doing this, right?
Correct. When testing resources were limited, being very specific to who got tested, only exposures to known cases, only people who traveled in high risk areas was reasonable. At this point, we have more testing capacity, and since so many people are asymptomatic, we know in large areas of the country we've under tested. So in our area where we have testing available and don't have a very high infection rate in a large population that is overwhelmed with the virus, it makes sense to use the resources to try to identify some of these asymptomatic people who may or may not be spreading this infection. And ultimately, that's going to have to happen all across the country in order to slow down the rate of transmission.
So if folks want to have something like that, if some business leaders around here would like to maybe see something like that for their business, who do they need to get in touch with? Should they contact Reliant? Do they contact your office? Or what would be the right way to go about setting that up?
they can contact me, or they can contact Jeremy Bergman with Reliant, and either one of us can get the arrangements made. We pretty much can do it within a day or two notice. At this time, we'll make, if we get more business, seeking testing, we may extend our dates out a little bit, but we're able to do it pretty quickly so far. And so far, all the businesses have been pretty pleased with the response.
And as for tomorrow's event at West Memphis, reminding folks of that one more time, it's from 8 a.m. until 6 p.m. And you don't have to have an appointment. You just show up. Is that right?
Yeah, that's correct. I mean, if you don't need testing, don't worry about it. We won't do it, but we'll gladly screen anybody who thinks they qualify or need it. We're not going to turn anybody away for screening. So we'll talk to everybody and see, if in fact they are a candidate, and if they need to be screened or they're high risk, we'll go ahead and screen them.
Well, as of the last check, 73,215 tests performed in the state of Arkansas. So the hope, of course, more testing is what we're always hearing from our leaders, and a company and a local partnership seeing that happen, coming together to make it happen. So we appreciate your effort, and thank you for coming on. I know I got to thank you for being patient with me, because I only wasted about a half an hour of your time before we got started here, maybe longer. Can I just say I appreciate you, and thank you for you didn't get impatient one time with me, so that's I owe you for that. I thank you.
No problem. Thank you for having us on here.
Dr. David Diffenay joining us from Diffenay Family Practice, and we'll see him tomorrow in West Memphis. Everybody for joining us on NEA Report. Always an honor to have you in with us. We'll be back with more news from Northeast Arkansas tomorrow. And don't forget, we'll be back with breaking news all throughout the night and tomorrow as well, because when breaking news breaks out, that's when NEA Report breaks in. I'm Stan Morris reporting at Jonesboro, and guess what? You're up to date.